Hi, my name is Miracle Perry, and we will be discussing the gamble of medical tourism. Annual doctor visits are essential for maintaining good health and preventing minor issues from escalating into serious conditions. For some, surgery becomes necessary, whether for medical reasons or cosmetic enhancements. Medical tourism, as defined by the Centers for Disease Control and Prevention, refers to traveling to another country for medical care. Medical tourism is dangerous because of the overlooked possibilities of complications and infections. While the promise of lower costs and faster access to medical procedures may seem appealing, the associated risks are significant. Medical tourism presents far more risk than reward and should be strongly reconsidered. While considering medical tourism, several potential downsides should be taken into account. One of the key concerns is the possibility of language barriers. If you receive care at a facility where you do not speak the language fluently, misunderstandings about your treatment could arise, increasing the risk of complications. Additionally, travelers may face the risk of contracting rare or antibiotic-resistant superbugs, which are more common in certain regions and can be difficult to treat. The standard for healthcare providers and facilities in other countries may also differ significantly from those in your home country, potentially leading to substandard care. Another major concern is the quality of medications. In some cases, drugs may be counterfeit or of poor quality, further jeopardizing your health. The risks highlighted in this slide include the importance of thorough research and caution when considering medical care abroad. One of the main attractions of medical tourism is the potential for significant cost savings. Prices for medical procedures can be much cheaper in other countries compared to your home country, making it an appealing option for those seeking affordable care. In addition to lower costs, patients may also benefit from shorter wait times and quicker availability of appointments, which can be major advantage for individuals who need immediate care. Another convenience is the ease of booking appointments and arranging travel. Many medical tourism providers offer online booking options, allowing patients to schedule both their medical procedures and travel logistics with just a few clicks from their phone. This accessibility and efficiency make medical tourism an attractive option for those looking for quicker and more affordable care. The Dominican Republic has become a popular destination for those seeking budget-friendly liposuction, with clinics advertising prices up to 88% lower than what patients would pay in the US. While many view the financial savings as a reward, believing they can receive the same treatment abroad for a fraction of the cost, the reality is that medical tourism carries significant risk. I would like to illustrate two cases, one of Tamika Capone and the other of Jacqueline Smith, which clearly demonstrate the dangers of medical tourism. For Tamika Capone, she traveled to Tijuana, Mexico for bariatric surgery after hearing about a friend's successful experience. The cost of the procedure in Mexico was just $4,000 compared to $17,500 in the US. Unfortunately, Capone contracted a rare antibiotic-resistant superbug, leading to prolonged treatments and over $30,000 in additional medical bills. 3 days after the procedure at Grandview, as she waited in the San Diego airport for her return flight, she said her main incision started to leak. Back home in Jonesboro, she got worse. Over the next few days, she said she was hospitalized twice and developed an abscess that doctors had to cut open and drain. This case highlights the hidden dangers of medical tourism, where the pursuit of cheaper care ultimately resulted in far greater financial and health risk. The other tragic incident highlighted by medical tourism is that of Jacqueline Smith. Jacqueline Smith, better known as Jackie O from the popular television show Wild 'N Out, traveled to Miami, Florida for cosmetic surgery, specifically a gluteal augmentation procedure after undergoing liposuction the day before to transfer fat to her buttocks. According to a report by the Los Angeles Times, Jackie began experiencing severe symptoms, including burning sensation in her head. She was rushed to the hospital where she was later pronounced dead. An autopsy revealed that Jackie had suffered swelling in her brain and bleeding around her torso, which were likely complications of the surgeries. As reported by the Los Angeles Times, the cause of death officially was linked to complications from a Brazilian butt lift. In order to help minimize the risk associated with medical tourism, here's a list of things you can do prior to your surgery. It's crucial to do thorough research before traveling. Start by checking the qualifications of the clinic or healthcare provider you plan to visit, ensuring they are accredited and have a good reputation. Start with a simple research of just Google reviews. It is also important to learn how to effectively communicate with the medical staff, especially if there's a language barrier, to avoid misunderstanding during your care. Check and see if they'll have translators, if you need to bring a translating system. And additionally, arranging follow-up care with your healthcare provider at home is essential to ensure you're following the correct post-op instructions and monitoring your recovery. We want to make sure to obtain all necessary documents, including medical records and procedure details before traveling abroad. Have this information on hand to help with continu- continu- continuity of care and allow your home provider to offer guidance in any complications that may arise. Taking these steps can significantly reduce the potential risk of medical tourism. All in all, medical tourism may initially appear to be appealing, largely due to persuasive marketing that highlights the benefits. But there are numerous significant risks that are often overlooked and need to be carefully considered when traveling abroad. Thanks for listening to my presentation. These are my references, and I hope that you learned enough about medical tourism to get you to do your research. Thank you.